Hi, this is Scott Levy, Chief Medical Officer at Doylestown Hospital, standing outside our COVID pandemic tent, which has been in activity for many, many months during this pandemic. We're going to be taking a tour inside and getting to see some of the events and some of the things that we use this tent for. However, the good news is that with the numbers going down, we really don't have need for the tent on a daily basis, and this tent will be disassembled and returning this area to a parking lot in the very near future. However, even though the tent is coming down and the pandemic is lessening, it does not mean it's over. And we're going to be talking a lot more about that during this segment. This COVID tent has had a number of uses over the last several months. Most specifically, for those patients from the community who benefited from monoclonal antibodies, upwards of 10 to 15 patients a day, this is where those infusions were given for an hour and a half. Because these were active COVID patients, we had to be very careful to discern them and separate them from the rest of the population in the hospital. This is also where community members who needed X-ray or other lab tests who were known COVID positive would get those tests done, again, to keep them isolated from the rest of the institution and the rest of the population. On days when we were really busy with a lot of COVID patients would actually be triaged here as well. Fortunately, we're at the point now where this tent is going to be removed because we can manage all of these needs now within the institution in a separate area. The volumes are now low enough to do so. It's very exciting for us to be able to manage our population of patients without needing that tent. The number of patients who are now coming to the hospital with COVID is small enough that we could do that within the walls of the building in an isolated area for the rare patient who needs monoclonal antibody testing. Certainly things, as we know, are improving. Evidence suggests that as many as 25 or 30% of the population in this country may have had some natural immunity to COVID, having had either a symptomatic or an asymptomatic course, even if not tested. And we're approaching 15% of people in this country who've had at least one dose of the vaccine. As we reach the point where nearly half the population is vaccinated, that means there's a bit of a wall. The virus can't spread as quickly as it did before if 1 out of every 2 people who it's exposed aren't going to get sick. What that means is we're really getting to a point where we're very excited that the numbers are going to continue to decline. However, it really is critical to continue masking. And this is not just lip service, it's the reality. The data suggests this. The CDC has recognized this, and in a small setting, indoors, when everybody is known to be vaccinated, it's not necessary to wear a mask, nor is it necessary to socially distance. The likelihood of a vaccinated person actually transmitting disease to another vaccinated person is nearly nil. If you're in a group setting and not everybody's been vaccinated, certainly that's got to be really careful to make sure that that non-vaccinated person is of low risk, because there's certainly that possibility of still getting sick with this virus, especially with the various variants we have around. All that being said, over the next 4 to 6 weeks, the volume of vaccine availability is going to continue to increase. There are numerous additional sites being brought online to vaccinate those people, and we expect by the warm and hot summer months that things will be much more normal than they were before. So please keep in mind, get your vaccine when you can. We're still working through the 1A. Vulnerable people need to be in the front of the line. That's the CDC and Department of Health guidance. And we're moving those to the less sick people in 1A. And the expectation is sometime by the middle of next month, just about everybody in 1A should have access to a vaccine somewhere in this Pennsylvania area. So good luck, be well.